We can give maybe 5 minutes. I can see we are 21.
That's okay, Evelyn. So we begin at 95.
Sure. All right, I think we can begin now. I hope I'm audible. Can somebody confirm?
Yes, we can hear you.
All right, good evening, all of us, and welcome to today's session. And I would like to introduce myself. My name is Evelyn Nafula. I'm the nurse in charge at AR Healthcare, heading all the nursing services. And today's session, we are here to discuss on catch-up vaccines for back to school for children. And the discussion points will mainly be the importance of the catch-up vaccines and the ones that are recommended for the children. And before I even go further, I want to introduce to you also our presenter for today is Dr. Judith Amolo. She's a consultant pediatrician, a trained medical doctor specialized in peds. She has over 10 years of experience, worked in both private and public sectors, and she has also a passion for development in pediatric care. And currently she's a consultant at AR Healthcare, Embakasi Outpatient Center, and she has admission rights at AR Hospital and other hospitals. Would love to hear from all of you. For all of those who are joining right now, I would love that you mute your mics so that you will be able to listen to our presenter talking to us on catch-up vaccines for back to school for children. And I would also want to bring to your attention that we are going to have a recorded version of this webinar, which will be available for those who will not have attended. So thank you very much again. Once again, I will be your moderator. My name is Evelyn. In case you have any questions, kindly put it up in the chat. I will be reading out at the end so that Dr. can address them. Welcome, Dr. Amolo.
Thank you so much, Evelyn, for the kind introduction. As she's mentioned, my name is Dr. Judith Amolo. I'll be our presenter for today's session. First of all, I would like to thank everyone for taking their time this evening to join us for this very important topic, catch-up vaccines for back-to-school children. Our children have been on a long holiday, almost 2 months in December. Many of them have resumed in January. And when they go back to school, they're intermingling with each other. They're at risk for catching various infections. So this is a very important topic. So in today's session, we are going to go over why catch-up vaccines are important. And then I'm going to take you step by step through all the catch-up vaccines that are recommended for children. It'll just be a brief overview of why the vaccine is important. And I'll tell you a little bit about the vaccines. So the outline for our presentation today, we're just going to do a small brief of what exactly are vaccines. What exactly do we mean when we say catch-up vaccines? I'm going to touch a bit on the vaccine schedule that we normally use in our country, Kenya, and I'm going to go individually about the catch-up vaccines. So to start us off, the biggest question we have is, what is a vaccine? So a vaccine is a dead or a weakened version of any bacteria or virus that is given to a person, and it tricks the body into building immunity against that bacteria or virus. Our body's immune system usually remembers that a weakened version of the vaccine was given, and it already has the antibodies ready to fight, to mount a response anytime you encounter this disease or if you come into contact with the disease. So that's just a brief of what a vaccine is. So why do we need to get vaccinated? Historically, vaccines have been scientifically proven to protect one from serious disease now and even later in life. Through vaccines, we have been able to eliminate and eradicate several diseases. We know smallpox has been eradicated. Polio is on the way to eradication. So the vaccines have a very important public health function in that we are able to eliminate and eradicate several diseases. Hopefully, we can eradicate most of the diseases which we have right now through vaccination. Vaccines also protect the community around you by stopping the spread of the disease. The more people who are vaccinated, the more the disease is eliminated from circulation, such that even if you encounter, we go out in our social settings, in our communities, at work, at school, in crowded settings, the diseases are not spread to the community. So by people getting vaccinated, we break the cycle of the spread of the diseases. Some vaccines provide lifelong protection when they're given, while in other cases, booster or extra doses are needed to continue to provide you with protection. So some vaccines you'll hear you get 1 or 2 doses and it protects you for the rest of your life, while some vaccines you keep hearing that, for example, like the vaccines we give at 6 weeks, you have to come again for a booster at 10 weeks, you have to come again for a booster at 14 weeks. The purpose of these boosters is to strengthen the immunity, which you're already getting from the vaccine. The more the doses you get for these extra doses you get, the stronger your protection, so that it protects you from getting the disease and also protects you from spreading the disease to other persons. So why catch-up vaccines? This is going to be a bit of a repetition, but I'll repeat it in perspective of catch-up vaccines. So catch-up vaccines, why are they important? They protect our children when they're in school from diseases that are easily spread in school and other community settings. A child might come with an infection from their house and there are other children in the school. So we give the vaccine, number one, to protect that child from the disease. And we also give the vaccine so that that child does not spread the disease to their classmates or other people in their environment. The vaccines, the catch-up vaccines, they protect the children from diseases that can cause serious complications or death. Serious complications or death are the things we fear most from the vaccines, but there are also other effects of the vaccine in terms of financial loss from coming to the hospital, having to spend money bringing the child to the hospital. The parents have to take time away from work. The child also misses days of school because they have an infection. So vaccines, they help protect these children from the diseases, and your child is more healthy in terms of not just the physical health, emotional health, mental health, and everyone at home is more comfortable when you have a child who's healthy. Vaccines, catch-up vaccines, they also help to reduce the overall spread of infections in the school and in the wider community. Because if you vaccinate the children in school, these vaccines are not spreading from child to child in school. And in turn, these children are not bringing some of these infections at home, where sometimes we have people who are high risk for serious complications from infection. Maybe they have reduced immunity. So you have a child who's not bringing infection home. And it also protects even the adults and the other children in the home who are not exactly in the school setup with that child. Also, the catch-up vaccines are important because we have children who sometimes have missed some vaccines or they have fallen behind on their vaccines, either due to lack of access. During the time when we've had this COVID, many parents were not always able to take their children for their vaccines on time. So catch-up vaccines are an opportunity for children who have missed these vaccines to be identified and to be able to catch up on their vaccines. Other reasons they miss, some children might be sick at the time when the vaccine is due, so the vaccine is postponed. So when you schedule a catch-up vaccine, when you take a provider just before you go back to school, if there were any vaccines that were missed, we are able to catch up on the vaccines. Okay, so before now I go specifically into the catch-up vaccines, which ones are important. I've just projected our vaccine schedule that we use on Kenya, the expanded schedule for routine immunization in children. So these are the different vaccines that are available for the children in Kenya. Some of the vaccines are available under the Kenya Expanded Program of Immunization, which is the so-called government vaccines. And some of the vaccines are also available in the private sector. They may not be available as part of the KEPI, not because they are not important, but many times in our country, it's more of a funding issue. The government may not be able at this point to financially cater for all the vaccines for the entire population. So the government may pick a few priority vaccines as they work towards introducing the other vaccines in the vaccine schedule. So at birth, we normally vaccinate against 3 diseases: BCG for TB, polio is given at birth, hepatitis B is given at birth. Many of us are familiar with the ones for 6 weeks, 10 weeks, and 14 weeks. We vaccinate against DPT, which is diphtheria, whooping cough. We also give tetanus. We also give Haemophilus influenza and injectable and poliovirus. Those are the vaccines we normally give at 6, 10, and 14 weeks. It also comes with hepatitis B. We also vaccinate against pneumonia, which is a common cause of respiratory illness in children. We also give routinely vaccines for rotavirus, which causes diarrhea and vomiting. Like now we are seeing many cases of rotavirus in the clinic. Then at 6 to 8 months, we normally vaccinate against influenza. Then from 9 to 11 months, that's when the children come for the routine measles vaccine. We have the KEPI measles rubella vaccine, but also in the private sector, you have an additional MMR vaccine, which gives measles, mumps, and rubella. I'm sure many of us have seen in the last few months, the cases of mumps have gone up. So we have a vaccine for that is usually given at 9 months. We vaccinate against yellow fever, especially for those children who will be traveling outside the country. Meningitis vaccine, we started from 10 months of age. So from 12 months, we also vaccinate against cholera. Cholera is the one I'm sure many of us have been hearing about in the news. We actually have an active cholera outbreak in some counties in Nairobi included in Kenya. And Nairobi is one of the counties where we have an outbreak. Varicella, the chicken pox. We have a chickenpox vaccine. We have vaccines for hepatitis A. We also have a vaccine for meningitis. 18 to 24 months, we give booster shots of the measles. We also give booster shots of hepatitis A. We also give booster shots of the DPT and the pneumonia, which was given at 6, 10, and 14 weeks. This is to enhance the immunity from the booster shots that were given earlier when maybe the baby's immune system was not mature enough to form a strong response. So with the booster shot, we are able to amplify the protection for the baby against these 6 diseases. We also have a booster shot for pneumonia. From age 2 to 5 years, we have the typhoid. We have the typhoid vaccine, which we give we start at 2 years and we give a booster dose every 3 years. From age 5 years, we have the booster dose for the Tdap. That is the booster dose for the DPT, the one we gave at 6, 10, 14 weeks, the one we followed up with a booster shot at 18 months. We also give a booster shot at 5 years, which gives you 10-year protection. Annual flu is very important. We're going to talk a bit more about it as we go ahead. 10 to 14 years, the HPV vaccine, the human papilloma virus. That one is a vaccine that came on board as part of the KEPI in 2019, but has been available in the private sector for several years. We're going to talk a bit about it. So you see, we have many vaccines, so we've been able to reduce substantially the cases of diseases we have from these diseases over the last few years since these vaccines have been in the Kenya Expanded Program of Immunization. Also to mention, it's important that children should get vitamin A every 6 months from 6 months to 5 years of age, and deworming should start from 1 year, and it's given every 6 months. All these vaccines are available at all our AAR healthcare clinics. So now we are going to jump right into the booster vaccines for children. These are the vaccines that we prioritize for children who are going back to school. So we are going to talk about all these vaccines individually. I'll tell you a bit about the diseases, and I'll tell you a bit about the vaccines and what the vaccine will do for you. So the first one I'm going to start with is cholera. The reason I've picked cholera as the starting point is because we have an active outbreak. Cholera is a rapidly dehydrating diarrheal disease caused by a toxin-producing bacteria called Vibrio cholera. It's transmitted by eating or drinking something that is contaminated with the cholera bacteria. The symptoms are profuse watery diarrhea. Any person presenting with profuse watery diarrhea, their suspicion of cholera should be high. Severe cases of cholera need to be quickly taken to hospital, and we normally give intravenous fluids and antibiotics very quickly because cholera can kill within a few hours if left untreated. Even within 24 hours, we can lose our patient if cholera is not addressed immediately. Untreated cholera mortality is about 50 to 70%. Even in some cases where we are able to give treatment on time, mortality is even as high as 1% in some cases. So cholera is a disease which has a lot of public health perspective because it spreads very quickly, and when you get cholera, the symptoms can be very severe in a very short amount of time, sometimes even before people are able to get to the healthcare facility. So this is from our news here, local news. I've just clipped this from our local news. On 19th of October, the Ministry of Health, it issued a statement alerting to a cholera outbreak following isolation of the Vibrio cholera bacteria in the National Public Health Microbiology Lab. The first cases were detected following a wedding in Kiambu County. Since the confirmation of the first case, which was on 8th of October, the number of suspected cases as of 14th January was 3,970 cases, and we've had 70 deaths from the cholera. The highest caseload has been recorded in Machakos County, where we've had almost 37% of the cases, followed by Nairobi with almost 27% of the cases. This outbreak is currently active and has involved more than 13 counties. But as we can see, Nairobi County, where we are, is one of the most affected counties in terms of this cholera outbreak. So why is the cholera vaccine important? There is a vaccine to protect against cholera. It's a safe and effective way to protect against cholera. And this vaccine can help in controlling the outbreaks, including the one we have. When a significant part of the population is vaccinated, the spread of the cholera can be spread and the number of cases can be reduced. If you have 100 people in one setting and where they have been exposed to cholera and majority of those people who are infected are vaccinated, the people at that setup, people who've been exposed are vaccinated, we're able to break the cycle in that these people are not able to go out into the community and spread the cholera to other people who maybe were not even, like, for example, in the first event of the wedding. You have a wedding, there are people in the wedding, they've gotten infected, they have left the wedding, they have gone to other places, they have gone to their homes, their communities, and they have infected other people. The cost of vaccination is much lower than the cost of treating cholera cases. It's most effective when it's used in combination with other interventions, such as ensuring access to clean water, ensuring you have good hygiene and sanitation. So it's not a substitute. The vaccine itself is not a substitute for making sure you're washing your hands or you're careful where you're eating, making sure your food is well prepared. So the cholera vaccine helps. It's an adjunct to sanitation measures to help protect people against this disease, which has very severe outcomes. So the vaccine we have locally for cholera is called Shankel vaccine. It's usually given from 1 year of age. Many people will be happy to hear this. It's an oral vaccine. It's given 2 doses, which are normally given 2 to 4 weeks apart. And when you get these 2 doses, it gives you 5-year protection against cholera. After these 5 years, you'll need just 1 booster shot, which is given every 5 years. So now in the midst of our outbreak, it's highly recommended that this vaccine be given to our children who are going back to school. And also, it's also available for adults. This vaccine is not exclusively for children. Even adults are eligible to come for the vaccine. We also vaccinate adults in our AAR clinics. So the next disease I'm going to talk about is pneumonia. So pneumonia is the second one, which we consider when we are talking about catch-up disease. Streptococcus pneumonia, this is the name of the bacteria that causes pneumonia. It's one of the leading causes of pneumonia and even meningitis all over the world. It was also one of the leading causes of pneumonia in our setup. Pneumonia vaccine was introduced into the Kenya Expanded Program of Immunization in 2014. Because the government was worried, our public health department was worried that this pneumonia was contributing to many cases of children being admitted and even mortality in our children, especially the children who are under 5 years, where the burden of pneumonia is usually the greatest. According to WHO, a child dies of pneumococcal disease every minute. This bacteria, strep pneumonia, is usually a normal inhabitant. It's found in the nose and throats of many people. So not everyone who is sick, actually, let me rephrase that. Not everyone who is in hospital with this strep pneumonia bacteria is the only one who has the infection. There are a number of people, healthy children and healthy adults, who are walking around with the population, with the strep pneumonia bacteria in their nose and in their throat. It's normally transmitted by respiratory droplets, by people who cough and they're sneezing, especially in crowded setups like schools or offices or in the public places. So when someone coughs, this bacteria, it comes in the form of droplets and it inhabits your nose and your throat. So many people, actually 10 to 85% of children under 5 years are walking around with this bacteria in their noses, and up to 4 to 45% of adults are walking around with this bacteria. So the difference comes in that this bacteria can penetrate the barrier inside the nose and go into the bloodstream, and now it causes infections. So when the bacteria, which was just hanging around in the nose, penetrates the barrier, it goes to the chest, it causes pneumonia, it can cause ear infections, it can cause throat infections, it can cause sinuses, and it can cause meningitis. So for people who have weak immune systems or children who their immune system is not fully developed, there are a higher risk of this bacteria penetrating from the nose and the throat into the bloodstream and causing disease. So the introduction of the pneumonia vaccine has actually led to a substantial drop in infections in our country. I remember at the time I was working I think I was around the Kenyatta National Hospital where we were working with children in the wards, and we noticed like about a year or two after this pneumonia vaccine was introduced, the cases of the number of admissions of children who were coming to the ward with pneumonia was slowly falling over time. So actually the introduction of this vaccine in Kenya actually led to a tangible result where we've noticed over the last few years, the cases of pneumonia due to this strep pneumonia bacteria have gone down. So this vaccine, it helps to reduce the nasopharyngeal colonization, leading to individual protection. What this means, this vaccine prevents you from, like if you're around someone who's coughing, it prevents this vaccine from resting on your nose and your throat. The vaccine has nowhere to rest when you are vaccinated. It also leads to a reduction in pneumococcal transmission due to reduced disease rates. If fewer people are carrying this bacteria in their nose and their throat, they're unlikely to spread it to other people, and we get less protection. Hard protection for those who are at risk of disease. We know some people have low immunity and they may be at a higher risk of getting this pneumonia. Maybe they have a chronic illness or an underlying condition that makes their immunity weak, makes them unlikely to fight infections, makes this bacteria get into their bloodstreams much faster than someone who is of good health. So when we talk about herd protection, like the more people who are vaccinated, we are like a herd. More people are protected. The more people who are vaccinated, even the few people who may not have gotten the vaccine end up getting secondary protection because the disease is not transmitting from more of the people who are vaccinated. So the more people we vaccinate, the more the group of us, the more the herd, the more the group of individual or children in a setup are protected. Even the ones who are not vaccinated, if we vaccinate the people who are eligible to give the vaccine, we protect these people from getting the vaccine. So this pneumococcal vaccine has led to an overall reduction in all cases of pneumonia admissions. So the vaccines we have in Kenya, we have two types. We have the pneumococcal conjugate vaccine 10, the PCV10, which protects against 10 serotypes. There are different types of the pneumococcal. This vaccine mutates a little bit and forms different serotypes. So we have the PCV10, which protects against 10 serotypes, and we have the PCV13, which protects against 13 serotypes. So when you come to the clinic, both the vaccines are available, so you can discuss with your healthcare provider which vaccine you're going to take on the day you come for the vaccine. So the schedule of this vaccine, we give it at 6 weeks, 10 weeks, and 14 weeks when the babies are still very young, when their immune system is still very naive. They may not be able to mount a sufficient enough immune response to give them a long-term protection. So we give a booster. A booster dose is recommended for 15 months to 5 years of age, just to strengthen the protection which they received from the first 3 doses. So while someone would ask, why don't we wait then when the baby's immune system is stronger and give the vaccine when the baby is older, like maybe 15 months to 5 years? But these children who are 6 weeks, 10 weeks, and 14 weeks, they are very young. They have still not built the immune system, so they are more predisposed to get the vaccine as compared to the older children. These are the children who are at a high risk of getting this pneumococcal. So we can't wait until they are 15 months, because if we wait until 15 months, we're going to lose many of the children. So we give the vaccine early to give them as much protection as we can. And then as they get older, we boost the vaccine to give them sufficient protection, which will last them a longer time than the one which they got when they were 6 weeks, 10 weeks, and 14 weeks. So when you come to the clinic, this vaccine is available. Before your child goes back to school, ensure that your child has received this pneumococcal vaccine to protect your child themselves from the pneumonia disease, and also to protect your child from spreading the infection in school. Or even if other children in school are vaccinated, your child is also protected. And also the people at home are also protected if your child does not bring this infection from home. So just to expound a bit on pneumonia in Kenya, due to this pneumococcal vaccine, the cases of bacterial pneumonia have dropped substantially in our setup. Now we have a new infection which is dominating now that the vaccine is bringing down the cases of bacterial pneumonia. We're finding like bacterial infections, especially including strep, they now account for only 27% of cases of pneumonia in children. Now, viruses are the dominant infection which we are seeing in children. Local studies are actually showing, this is studies in our setup, that actually showing that 61% of cases of severe childhood pneumonia are now due to viruses. We've done well with tackling with the pneumococcal, especially since it was introduced into the KEPI program, but now we have a new threat on the block, viruses. Up to 45% of pneumonia cases, they show actually evidence of viral to bacterial co-infections. Now, every time a child comes with pneumonia, you find that our use of antibiotics has gone up, especially for viral infections. And these viral infections do not respond to antibiotics, so they're just contributing to antibiotic resistance. So now our new public health focus is on developing vaccines against these viruses, which are increasing the cases of severe childhood pneumonia. We have one vaccine for one of these viruses. We have the influenza vaccine. So now I'm going to go straight into our third disease, which is part of the catch-up vaccines, is it influenza. So I'm going to focus just on one virus. There are many, many viruses which cause infections. Not all viruses that cause respiratory infections are actually due to flu. There are other causes. We have the RSV virus, which many of us are hearing about. COVID is one of the viruses that has actually, it's been a pandemic for the last 2 years. So my focus is just on the influenza virus. Just to be clear again, influenza is one of the viruses, not the only one that causes viral respiratory infections. So there are different acute respiratory infection in influenza. It has different subtypes. It has influenza A, B, C, or D subtypes. The influenza A or B viruses are the ones that dominate, causing most of the viral infections, which we see in our setup. Rarely influenza C causes infection, but even if it causes infection, the infections tends to be milder than the one caused by influenza A or B. In temperate climates, that's in the northern and southern hemisphere, the US, the UK, Australia, influenza tends to occur mainly during the winter, while in tropical regions like where we are, influenza has been found to cause infections all year round. And in addition to causing infection all year round, it causes outbreaks irregularly. One of the biggest influenza outbreaks, which sometimes some of us may remember, but now everything has been overtaken by COVID because of the scale and the magnitude of COVID. But one of the type A influenza viruses, H1N1 virus, it caused a pandemic in 2009, where there were many cases of respiratory infection all over the world due to this H1N1 virus, which is one of the type A influenza viruses. Worldwide epidemics every year, they result in about 3 to 5 million cases of severe illness and about 300 to 600,000 cases of respiratory deaths. So this influenza is a disease which actually has a very consequences in our public health. So in Kenya, the human influenza A and B viruses, they cause seasonal surge of disease transmission, especially through the so-called flu season. I see in the media, I remember last year, there was a time where almost everyone in Nairobi was having a cough, and actually flu virus was found to be one of the causes. It comes almost every cold. It likes the cold, the rainy season. That's when we tend to get our surges of infection, but flu is in our setup all year round. So how is the influenza virus transmitted? It's transmitted by contact with respiratory droplets when someone coughs or sneezes, or someone coughs on their hands and then they touch surfaces. It's also transmitted through surfaces. It spreads quickly in crowded places, including schools. So some of the symptoms are cough, sore throat, running nose, headache, muscle pain, joint ache. You feel very weak. The symptoms can even last up to 2 weeks, and you have a severe cough that it just doesn't seem to go away. While in most cases, the flu resolves on its own, because we said viral infections don't respond to antibiotics, influenza can be life-threatening, especially in some people who are high risk, including our very young children who are under 5s and also pregnant women. Influenza is usually can cause severe complications. Influenza can lead to pneumonia. It can lead to sinuses, ear infections. Influenza can also affect the heart. You can also get meningitis from influenza. Pregnancy complications. Pregnant women are at high risk. You have a child who goes to school. Your child gets flu in the house. You're in the house. Your child comes and infects you with flu in the house. Influenza has been known to cause pregnancy complications, including prematurity. Low birth weight babies, it can even cause pregnancy loss. So we have an influenza vaccine. So in countries with year-round activity like ours, WHO recommends that we vaccinate with the most recent strain of the influenza vaccine. So what do I mean by the most recent strain? Influenza is a vaccine that is constantly evolving. When it latches to someone and it sees that maybe persons are able to fight the disease off, it mutates itself into a different. So every year, we have an organization, a team in the WHO that monitors this influenza virus that is circulating, and the formulation of the vaccine is usually updated every year. So the influenza vaccine is usually most effective when the circulating viruses are matched with the vaccines. So they try and collect data on which influenza A and B strains are circulating, then the vaccine is made based on the circulating strain. So this vaccine is updated once or twice every year. The vaccine usually protects about 50 to 80% of those who are vaccinating from getting the influenza. If you do get the flu, even after being vaccinated, your symptoms are usually very mild and they last for a shorter time as compared to someone who is not vaccinated. So who should get this influenza vaccine? First of all, the priority is the people who are at risk of some of those high severe disease and complications, children under 5 years, pregnant women. The vaccine can also be given to pregnant women, older adults, especially the adults over 65 years. They are at a high risk of getting influenza and the severe complications. People with underlying health conditions, people with diabetes, people with hypertension, they are more likely to get severe cases of this influenza vaccine. Then who else should get the vaccine? People who are at high risk of transmitting influenza to at-risk individuals. As healthcare workers, we fall under that category. We come into contact with many people who have respiratory illnesses, including influenza. So even us, if we get vaccinated, we are able to protect you, our clients. All individuals should generally be getting this influenza vaccine because it protects you from getting the flu and all this severe cough, which goes on for even 2 weeks. Okay, so the vaccine is given from 6 months of age. We normally give it as an annual vaccination every year. The vaccine usually covers 4 strains of influenza. As I mentioned, the data is collected on which are the most virulent strains at the time. So it normally covers 2 strains of influenza A and 2 strains of influenza B. So the vaccines we have in the market, we have the Vaxigrip Tetra and the Influvac vaccine. The 4th disease we are going to talk about is meningitis. Meningitis, the one I'm talking about, is specifically by this bacteria called meningococcus. It's the so-called meningococcal disease. The data from the WHO shows in 2020 in Kenya, meningitis deaths were about 5,300, which is significant, which was actually accounting for 2% of the total deaths we had in the country. The most common causes of bacterial meningitis in children are that's strep pneumonia bacteria, which we've talked about before. This bacteria, it doesn't only cause pneumonia, it can also cause meningitis. So if you get this vaccine against pneumonia, it also protects you against getting meningitis caused by this strep pneumonia bacteria. Now, the one we are focusing today is the Neisseria meningitis, which is the so-called meningococcal disease. This meningococcal disease, it occurs worldwide. It comes in a few sporadic cases. It's endemic in that it's found in certain areas. I'm going to talk a bit about the meningitis belt. And then it also comes in epidemics, where you just have a sudden surge of all these infections. So it's most frequently the people who are at a high risk of getting this meningococcal disease are children who are very young children who their immunity is still developing, adolescents and young adults who are now in school, who are now in boarding schools, who are in crowded setups. So when they're in this close proximity to each other, they are more likely to transmit this infection to each other. Why is this meningococcal disease important? It's very contagious and can be life-threatening. It can progress very quickly and can even be fatal within 24 hours. Up to 10% of patients die despite rapid treatment. 0 to 20% of surviving patients who survive this meningococcus, they have long-term complications. You've heard of people losing limbs after meningitis. You've heard of developing hearing loss. They developed motor impairment, where they're not able to walk, they're not able to move well, they develop neurological abnormalities like seizures. So this meningococcus is one of the bacteria which can have very severe complications. It's normally transmitted by respiratory droplets. These droplets, someone coughs, they're suspended in the air, they enter through your nose, through your throat, and then they penetrate into the blood barrier and they spread all over your body. Actually, it's been found that this actually, anytime 10 to 20% of the population is carrying this bacteria in the nose and the throat. But now people who are at a high risk of getting the disease, maybe due to underlying health conditions, they sometimes have this bacteria penetrating into their bloodstream. So the peak incidence of this infection, we find it in the children 0 to 4 years. And then there's a second peak in adolescents and in young children, due mostly to the crowded setup. So some of the risk factors for this infection to spread are social factors, where people are sitting together, they're sharing food, they're drinking together, mass gatherings, like in hostels, in schools, in festivals, including religious festivals. So some religious events, you find people are always advised to have the meningitis vaccine before they travel to those areas. People who have respiratory illnesses, like if you have a cough, you have a cold, you have a throat infection, you're at a high risk of this meningococcal bacteria entering your bloodstream. People with weakened immune systems, they're also at high risk. Most cases of meningitis, despite even not having any of these risk factors, they occur in healthy individuals. So this meningitis is not only for people who are at risk. Even someone who is completely healthy with no underlying medical conditions, they still may are at risk of getting this meningococcal disease, where this, I mean, it's found in this area usually throughout. It's usually there all year round. So it runs from Senegal and it runs all the way to Ethiopia. It touches parts of northern Kenya. Kenya is one of the 27 sub-Saharan countries that touches the meningitis belt in 27. Why is in 27 countries? Why is it important? This place is endemic and it's been found every 5 to 10 years. There's usually a massive outbreak, especially in the dry season, of meningococcal disease. The strain that has been found to be the culprit in this area is the serogroup A. Kenya has recorded sporadic meningitis outbreaks, which are fueled by drought and displacement of populations in the northern frontier districts. I think the biggest one, I don't know if some of us were around the time, there was one in 1988-89. I don't know if some of us remember that meningitis outbreak. I was in school at the time, but I remember it. So mass vaccination campaigns were introduced in 2010 in several countries in this meningitis belt. Among the people who are vaccinated, the cases have declined by more than 99%, which is significant because we've lost hundreds of thousands of people to meningitis in this meningitis belt whenever we have an outbreak. So meningococcal vaccination, it focuses on controlling the disease. It prevents nasal carriage. Like if you're vaccinated, you're unlikely to be a carrier of this meningitis bacteria in your nose and in your throat. So the chances of you transmitting it to other people around you are reduced. The vaccine is mostly used in prevention and outbreak response. I've attached a bit of a newspaper clipping here that was from 2019, where there was a high risk of meningococcal disease in northern Kenya, where it touches the meningitis belt, and the government actually went in there and it targeted the mass vaccination for people in Mandera who are close to the meningitis belt and they were at high risk of getting this disease. This vaccine has been found to confer long-lasting immunity. So we have 2 vaccines available in Kenya. We have the Menactra vaccine and the Nimenrix vaccine, which protects against 4 strains of this meningococcus. Strain A, which is predominant in Africa, strain A, C, W, and Y are covered by this vaccine. We still get a few cases of the other, but not as much as serogroup A. The vaccine is given as part of the regular schedule for children 9 to 23 months of age, but we also offer a catch-up vaccine for those who've not received the vaccine. For those who've not received the vaccine before 2 years of age, a single dose can be given from 1 year to 55 years of age, and it gives you lifelong immunity against the meningococcal bacteria. Okay, now the 5th one we are talking about is HPV, human papilloma virus. Actually, the government is about to launch a campaign on this human papilloma virus, possibly in the next 2 months. So the human papilloma virus, it's a sexually transmitted infection that causes genital cancers. It causes genital warts as well as oral cancer in both males and female. Many people will be infected with this human papilloma virus at some point in their lifetime. In most people, this virus causes no symptoms and it goes away on their own. But in some people, this virus remains persistent in the body. Persistence of this viral infection puts you at high risk of getting all cancers of the cervix, and various oral and genital cancers. This HPV virus has been found to be the leading cause of cervical cancer in women in our setup. The high risk there are different types of the HPV virus, but the high risk ones, there's type 16 and 18, which has been found to be responsible for 70% of all cervical cancers worldwide. So imagine if we had a vaccine and we were to eliminate this genotype 16 and 18, we'd eliminate almost 70% of cases of cervical cancer in the world. So why do we give this vaccine? In females, this vaccine can prevent up to 90% of human papilloma virus-related cancers. In males, who are also affected, because many people think of the HPV vaccine and they only think of women or females. This vaccine, it can also cause genital cancers in males. It can also cause warts in males. The HPV type 16 and 18 causes nearly 90% of anal cancers and a substantial proportion of oropharyngeal and penile cancers. Protection against genital warts can be gotten from this vaccine because these warts can cause a lot of physical and psychological distress for most people. There are hard immunity benefits. The more people who are vaccinated against the HPV virus, we break the transmission in the community, in that less people will be affected. Even the people, like if someone is vaccinated and they encounter the virus, they're unlikely to spread it to other people. So it provides herd immunity. The more people who are vaccinated against human papilloma virus, the more we stop the spread in our community. So the best time to get this vaccine is usually in your teenage years before you're potentially exposed to this infection. This vaccine is recommended for both males and females, but we find the emphasis nowadays is more on the females because of the cervical cancer, because it's actually found that this cervical cancer is a bigger public health concern, especially it's one of the leading. Cervical cancer is the number 2 cancer of women in women in Kenya. This vaccine can be administered from 9 years of age. It's usually given as 2 doses, 6 months apart for children 9 to 14 years. And if you come after 14 years, you get 3 doses over 6 months. Catch-up is usually available. Like if you get 1 dose of the vaccine and you don't come back after 6 months due to some reason, you come back 1 year, 2 years later, we continue with the doses from where you left off. So we have 3 vaccines which are available in the country. You can come and inquire about these vaccines at our AAR facilities. We have the Savarix vaccine, which is the oldest one we had in the market. It covers 2 strains of the HPV virus. It covers strain 16 and 18, which is responsible for majority of cases of cervical cancer. We have Gardasil 4. This Gardasil 4 was introduced as part of the Kenya program of a Kenya expanded program of immunization, where it's given as part of the KEPI for girls. It's been given for girls from aged 10 to 14 years. It's been given from the year 2019 as part of the government efforts, but it has been available in the private sector for several years before the government introduced it as part of the expanded program on immunization. We have another strain of the HPV vaccine, the Gardasil 9, which is not widespread in Kenya, but if you come to AAR, you can be able to access this vaccine. So the Gardasil 9, it covers against 9 strains. So the more strains which are covered, the more protection. So those are the vaccines we have available. I'm going to just deviate a bit and talk about cervical cancer in Kenya. It's one of the 2nd most frequent cancer among women in Kenya. The fatality rate of cervical cancer is 67%. Those are too many women we are losing. According to WHO 2018 data, 33 out of 100,000 women in Kenya have cervical cancer. That's too many. And actually 22 of these 33 die from the disease every year. Those statistics are just too high. Women between the age of 25 to 24 are actually advised to have pap smears every 3 years. 2021 data showed only 3.5% of women in Kenya are actually going for screenings. This number is very low. So it increases the chances of many women being diagnosed with late-stage cervical cancer because most women are not going for these screenings. Maybe we need more public health education to encourage more women to go for the screening. It's estimated about 9% of women in the population are harboring this HPV strain 16 and 18. And 63% of invasive cervical cancers in Kenya are attributed to HPV 16 or 18. If we give this vaccine, if we prevent our young girls and boys from actually getting this HPV attaching to their bodies, their chances of getting this cancer are markedly reduced. Okay, the other disease I'm going to talk about is hepatitis A. Hepatitis A is a viral infection that's usually transmitted by ingesting contaminated food or drink. It normally spreads in community. It comes in small outbreaks in the community and in school. I think the last outbreak I remember, there was a small outbreak in some parts of Nairobi around 3-4 years ago. So the incubation period for hepatitis A is about 2 to 6 weeks. So what you have like a setup. Like let's say you have a school where like they have eaten contaminated food or drink. So what usually happens, it takes 2 to 6 weeks before the symptoms appear. And during this time, the infection is spreading in the setup. You have maybe the kids in the school are infected, they go and take it home. Someone is preparing food at home or the child is touching something at home, infects other family members in the house, it infects other members of the community. So the infection can be spreading for a long time before the outbreak is discovered. So by the time the outbreak is discovered, you have many cases. So you have a silent infection occurring in the beginning, and then suddenly everyone presents with fever, diarrhea, vomiting, abdominal pain. But the biggest effect of hepatitis A is that it infects the liver and causes inflammation of the liver, which is the hepatitis, and causes liver failure in more severe cases. So what we normally see is jaundice, the yellowness of the eyes, which is a sign of inflammation of the liver. So hepatitis A is one of the causes, and this inflammation of the liver can usually be quite severe. Most children under 6 years, the disease is usually mild, but they are one of the spreaders of the disease. And only less than 30% of them present with this hepatitis, which is the inflammation of the liver. In older children and adults, they're usually more symptomatic, and these symptoms can go on for several weeks. You can have approximately 70% of these people are jaundiced in that they have yellow eyes. They have because the liver is inflamed, the liver is not able to process the bilirubin. So now bilirubin is circulating all over your body. You have yellow eyes, your skin looks yellow. Up to 40% of older adults and children with hepatitis A gets admitted. And you end up, some people even have yellow eyes, which persist for several weeks. It has even been shown in some cases to go even up to 6 months. Walking around admitted, there's no specific treatment for hepatitis A. So treatment we normally give is usually symptomatic, but this can cause a lot of distress. We have a vaccine available for it. It protects against getting the infection. And if you're protected against getting the infection, you're protected against getting severe liver disease. We have 2 formulations in our market. We have Avaxim and Havrix. These are given from 1 year of age. It's given as a 2-dose series, 2 shots, which are given 6 months apart. This gives you long-lasting immunity from this hepatitis A infection. Not only children are eligible, even adults, you can come in for this hepatitis A vaccine. They are available at all our AAR healthcare clinics. One of the other ones we are going to talk about today is typhoid. Typhoid fever is a serious bacterial infection caused by the Salmonella bacteria. In 2019, data shows Kenya had about 120,000 cases, and we lost 1,500 people to typhoid. It's spread by consuming contaminated food or water. The symptoms, it causes fever, it causes abdominal symptoms like vomiting, diarrhea, abdominal pain. If untreated, complications usually develop within 2 to 4 weeks. The most serious complication we have is intestinal perforation, where it can perforate. The virus can eat through your intestinal wall and perforate your intestines, which becomes a surgical emergency. A vaccine is available for it. Locally, we have the Typhim vaccine, which is eligible for children from 2 years of age with a booster shot recommended every 3 years. So this is our last slide. The last one I'm going to talk about, the DPT, which many of us are familiar with, the diphtheria, tetanus, whooping cough, polio vaccine, the one which is given at 6 weeks, 10 weeks, and 14 weeks. Just to let you know that when the vaccine is given when the babies are very young, when they're at a high risk of these infections, we don't wait. We give the vaccine when the baby is very young because they are high risk. So we can't wait for their immune system to be strong enough to get long-lasting immunity. Because they are high risk, we give it from 6 weeks, 10 weeks, and 14 weeks, but a booster dose is recommended. So for children who are aged 5 years and older, a booster shot is recommended to cover against diphtheria, tetanus, whooping cough, and polio. The advent of this vaccine has seen a marked reduction of the cases, but these cases are not eliminated. We still have a few cases of this in our community. So it's important for us to have our children vaccinated against this to reduce. Hopefully with time, we can eliminate these diseases from our setup, but they are not yet eliminated. So vaccination is important so that we can keep these cases under control. So there is a booster dose, which is given at age 5 years, and it normally gives you 10-year protection from the vaccine. So for our children who are 5 years or older, we recommend that they get this booster shot, because now our children are playing with each other. A child might fall, might get a cut, and when they get a cut wound on their body or they injure themselves, they're at risk of getting tetanus. Okay, so this vaccine is important. Whooping cough, pertussis, we've seen a few cases recently. Polio, we are hopefully on track from eliminating polio, eradicating polio from the globe in Kenya and even globally. So maintaining our vaccine will help protect our individual children, and will also help protect the community at large. This vaccine, if you protect your children in the house and these children are vaccinated, they're less likely to bring the infections home, even to the adults who are inside the house. They're also protected. Pregnant women are also at high risk for some of these diseases. So if your child is vaccinated, your child is unlikely to bring the infection home and put other household members at risk. So thank you for listening. I know I've talked a lot about these vaccines, but I hope I've opened your eyes to the different catch-up vaccines we have available. So I will hand it back to Evelyn for any questions.
Thank you very much, Dr. Molo. That was really good, and you've really gone into explaining so well on what really catch-up vaccines are for the back-to-school children. Those who joined late, actually our discussion points were mainly on the importance of the catch-up vaccine and the ones that are recommended for the children going to school. I would take a few questions, and please, if you still have questions, put them in the chat box. I'll be reading them out so that Dr. Amolo can address. I think I have already answered the one question that somebody had asked about the Varilix vaccine. I've already answered it. And Jerry is asking, Doc, that is it advisable to administer Gardasil vaccine to young women who have had hysterectomy?
When you have a hysterectomy, the surgery involves removal of the uterus, and part of the cervix can also be removed. But sometimes part of the cervix is there. So if you've had a hysterectomy, you are still at high risk of getting the HPV virus if you have part of your cervix there. So it's still recommended to get the HPV vaccine.
I think also to add on what Dr. is saying, remember the vaccine you're getting does not protect you from anything that you could have exposed yourself to initially. So probably you did a hysterectomy when you've already exposed yourself to a HPV virus. So the vaccine then, even if you are to get, will not. So this vaccine that you'll be given is not going to protect you from the past infection. It's just from the oncoming HPV virus that you would probably be exposed to. Thanks, Dr. Do you have any specific schedule recommended for someone who needs all these vaccines that you've talked about? All these catch-up vaccines. Do we have any specific schedule recommended?
Yes, we have a schedule recommended, but it might depend on individual factors. Some of the factors are the age of the person coming for the vaccine, also the interaction of the vaccines. There are some vaccines which are safe to give together, but there are some vaccines which might need to be separated by a certain duration. Another thing to consider is there's a minimal interval between giving certain doses of the vaccine. So we have to take into consideration when you received previous doses, and there's a certain minimal interval that has to be followed when you're giving the different vaccines. But it's possible to give all the vaccines, so you can come to hospital even as an adult, and we can be able to create for you a schedule, an individualized schedule, because it depends on the person and their age and the vaccines we want to give and the health status of the person who is getting the vaccine.
Thank you, Dr. And do we have any specific, does the PCV reduce carriage rates as well, like the meningococcal vaccine?
Yes, the pneumococcal, the PCV, the pneumococcal, the vaccine which I mentioned for pneumonia, it, in addition to reducing the rates of colonization of the pneumococcal bacteria in the nose and in the throat, it also protects you from the disease. So yes, it does reduce the nasopharyngeal colonization.
Thank you, Telewaki. You have just given us an additional info that also other parts of the genitalia can be affected by the HPV. It's not just the cervix, despite having the hysterectomy. So that's just an additional information of what we answered previously, Asante. What is the current recommendation? Thank you. What is the current recommendation on missed vaccine, like hepatitis? I guess this should be hepatitis B. I'm not sure. Or Dr. You could just talk about the.
I could touch on both.
Yes, B.
Okay, hepatitis A.
B.
Hepatitis A is given from 1 year of age with a booster dose given 6 months after the first dose. So anytime you come in, even if you come in at 2 years, we can give the vaccine the first dose at 2 years, and you come 6 months later for the second dose. Even as an adult, even a 15-year-old presenting, you get the first dose now, then the second dose you come in after 6 months. If something happens and you're not able to make it after 6 months and you come in 2 years later, we're able to resume where you left off. Like now we give you the second dose 2 years after you got the first dose. But for the best immunity, it's recommended that you come within the scheduled time, but sometimes circumstances happen and people are not able to come for the second dose. So if you've missed a vaccine, do not shy away from coming for the second dose. Even if you didn't make it on time, we'll still give you the second dose. Hepatitis B vaccine has been part of the KEPI, the expanded program of immunization, from 2002. So most of our children who are born in 2002, who are adults now, have received the hepatitis B vaccine at 6 weeks, 10 weeks, and 14 weeks. Many of us adults who are born before 2002 have not received this hepatitis B vaccine. So as an adult, you're eligible for coming for the hepatitis B vaccine. It's given us in 3 doses, 6 months apart. So as an adult who has not received the hepatitis B vaccine, you can come anytime for the vaccine. Why is hepatitis B important? It's one of the causes of liver disease, hepatitis, and is one of the leading causes of hepatitis. So if you protect yourself from getting hepatitis B virus, which is transmitted through blood and through sexual contact, you're able to protect yourself from getting this hepatitis B infection, which leads to liver disease, which can lead to liver failure. So adults, if you were born before 2002, you can check if you've received the hepatitis B vaccine.
Thank you, Dr. I'm not seeing any more questions in the chat. That then interprets we have no more questions, or if you do have and you maybe wish to speak or ask, you can always unmute and ask a question, but at the moment there isn't none. Just for those who got to join us later, we were doing catch-up vaccines for back-to-school children. Our discussion points mainly were importance of the catch-up vaccines and the ones that are recommended for back-to-school children. And also we touched on the cholera, typhoid, meningitis, pneumonia, HPV vaccinations, hepatitis A and B, and also Daktari went ahead to even talk about the DPT that is commonly used at the ages of 6, 10, and 14. So my name is Evelyn. I have been your presenter this evening on this webinar, and I would like to thank all of you for having taken your time to join us. And we hope to see you soon, maybe in another webinar of this relation. And we have been given this webinar by Dr. Judith Omolo, who is a very senior consultant in pediatrics. And also she has a passion in pediatric child welfare, healthcare,